Hi, I'm your host, Marsha Florence for Just As Podcast Live. Welcome, ladies and gentlemen, to our Thursday ritual, which is actually by Zoom, but we're here. So thank you all for tuning in today. And just want to, give you some information about a recap of all our past guests that you've seen recently in the last couple of weeks or months. So, when everybody working from home, it's kind of like funny when you call someone and you say, whatever business it is, whether it's DHS or if it's unemployment or if it's DTE, whatever. So everybody's working from home. And now you kind of get the gist that even though people are working from home, how comfortable they really are, whether it's their background setting, whether it's the noise of the dog barking, the children playing or crying. But what we have to realize too, ladies and gentlemen, that in this moment of the pandemic, we need as much resources and support as we possibly can get. So today, I just want to do a recap of some of the past guests that you guys had a chance to see, and always let you know you can give us a call if you have a question for the guests or need to contact them for any resources or services you may need. Now also I want to start off with, we do have a additional time slot with channel 56. So if you look at your screen, you can see the new additional time slot is every Wednesday. This is an old one. I'm sorry. Well, Wednesday and Friday. Okay, so I sent the wrong one. But I'm telling you now. So Wednesdays at 5:30 a.m. and on Fridays at 2:30 in the afternoon, 2:30. So this Friday, you'll see a show as well as every Friday. So a lot of you saying, I'm not up at 5:30 in the morning. We got that. We got that. So we want to thank PVS Channel 56 for giving us this additional time slot. For you home viewers, they can watch the program at 2:30 in the afternoon, but you can always go to the website, justastalkshow.org. You can go to YouTube and watch the show, or continue to watch the show on Facebook and enjoy some of the same programs that we air on Channel 56. So with that being said, also don't forget you can check out your cable lineup. We cover so many cities now. This sometimes I just repeat myself and I might miss a city. So I want you to check your cable listing and find us as well. And by us spreading out as much as we have, we're making sure that if you don't have cable, it's not the end of the world. Okay, you have channel 56. Do you know we cover Michigan and parts of Canada? And that is such a blessing and a wonderful thing to know that we get phone calls and emails from persons in Canada inquiring about resources that even though the show is aired and taped here in Michigan, the resources that you see, they're statewide, nationwide, so wherever you go, you can ask these same questions for all the agencies. If you're in New York, or if you're in Chicago, or if you're in Alabama or Atlanta, if you're in Canada, or if you're out the country, period, any resources that you see here on Just Ask, these agencies have either a chapter somewhere else, or they can still refer you to another state's resource center. So if you're traveling and you are a person with a disability, or you're going to see about a loved one with a disability, don't forget that these services are world around. They're not just local information, because we're learning about services and conditions that people know very little about. Sarcoidosis, scleroderma, myasthenia gravis. These are names that you say, well, what is that? I've never heard of that before. Well, the person who has that condition learns about it and tries to educate you. So what we do is get the information for you as well. Graves' disease. I have a relative that has Graves' disease. Matter of fact, my youngest brother called me. He said, have you done a show on Graves' disease? And I said, no. And he says, well, I just been diagnosed. So I'm going to, reach out to that agency and find out more about Graves' disease and see if we can cover that information. And I know that's something that talk show host Wendy Williams has, and I don't know if she's ever really talked about it or touched on it, but I want to educate our viewers about it and let you know that there are agencies and resources out there that you can hit. Okay, well, now without further ado, you notice today is a Marsha day. It's not a guest day. Okay, that's because it's recap day. So you will see a show periodically with just me and going over everything that we have talked about before. So the last show that you may have seen during our Facebook lineup was World Medical Relief. Okay, now I want to go over this brochure or flyer with you about World Medical Relief because on this one, the director told us, Josephine Jabara told us about their insulin program. A lot of you who are on insulin and having a hard time paying for it or can't pay the full amount, you can contact World Medical Relief and find out what the criteria is and see if you can get your medicine at a discount rate, which she says it's very easy. So if you see down below, it says $8.30 for a 30-day supply. Well, imagine how much you're paying in the pharmacy. So if you're 18 years and older, single earning is 36,000 a year. A couple is 41. Now that's reasonable, okay? Because on the outskirts, a lot of people don't have or are below that line and trying to get their medication and can't afford to. So I'm encouraging you all to contact World Medical Relief to not only see about insulin supplies, but any other type of medical resources that you may need. It might be a wheelchair, it could be a service bed, um, portable potty. So do take a look at this flyer here and take down that number, give them a call, let them know that you saw them on Just Ask Talk Show and that you would like some more information about their services. And they're right here in the Southfield area. All right, so with that one, what we're going to say is that uh, I hate to find out, and I say hate. I'm, I do. I hate to find out that someone is looking for a resource, and they don't have much money, and they suffering. What I mean by hate is that our elders are tossed between eating and medication. Well, World Medical Relief and these other people that we're going to talk about are the agencies that can help you so that you don't have to make that decision. Should I eat today or should I buy my medication? We want you to take your medication, ladies and gentlemen, and we want you to have food as well. So, with all these food pantries available, you can definitely call. And Gleaners and Forgotten Harvest provide a website as well as phone numbers that you can call and see if you can get something delivered, especially if you're in a senior citizen building or something. I'm going to tell you about one of our contact persons here too that may be able to help in some food delivery. So we do know we're coming upon the cold months of the year, and you want to make sure that you have good food as well as holiday food. So I do want you to start now, not later, now, in trying to get your resources lined up so that you won't be left out in the cold. I know I said that cold. All right, so so moving right along. Now, Detroit Recovery Project. We saw them recently too, and DRP, Detroit Recovery Project, has some new programs that they also are providing for residents of Michigan, and they have two locations to service you. So if you know someone who is experiencing depression or currently has went through a situation with substance abuse or and needs to be involved in a support group or any of those things, you definitely want to call Detroit Recovery Project and find out if you can, do an online conference with them, or if you can go in and sit in with their support group or meet with their case manager and open up a case to see if you're eligible for some of their services, which I see, you see it says case manager, harm reduction, health and wellness, master level therapist, medical assistance treatment, mental health services. And that's key right now. Mental health services is high on the list. Peer recovery coach and mentors, those are who are going through a substance abuse issues and need someone to be their support person, such as a phone call or a representative to go with you when you go for a job interview, or even when you go to the bank to cash your check, okay, so that you don't have a relapse. That's important. That's really important. Okay, so primary care recovery is yours. Recovery Training Institute, substance abuse disorder services, support groups, and suicide prevention. This COVID 19 matter has caused a lot of people to think in the way of depression and suicide. You need to reach out to Detroit Recovery and talk to someone, okay, so that that's not a part of your life. Try to save a life, try to save your own life at the same time. So these agencies do have the ability to connect you with resources and services to keep you afloat during this pandemic time, as well as during the cold seasons where things have changed. Our whole year has taken a toll, but even with that, the agencies are doing their best to keep us afloat. Okay, they're doing everything. I mean, from the food pantries to the medical resources being delivered, your ambulance services working overtime, trying to get to people to save lives, the medical staffs, the hospitals, the clinics, the pharmacists. You want to give hats off to each and every one of these agencies or services because they're working double time to make sure that we stay here on earth. All right. Now, with that, after that comes Comfort Keeper. Now, Comfort Keeper, even though there's this is Comfort Keeper of Plymouth, let me tell you, Comfort Keeper has is a franchise, so they have locations throughout. You'll be surprised. You say, well, I don't live in Plymouth. You don't have to. You can still call their number and find the office or services nearest you. And what I like about Comfort Keepers is that it allows you to stay in your home and someone to come in and help you. Okay, that is key to keeping our seniors uh, safe, as well as keeping our seniors comfortable in their own home. All right. Now, the nursing homes, and no offense to nursing homes and rehab centers and everything, they're overwhelmed right now, probably filled to the rim. So if you can work with someone like Comfort Keepers to keep your loved one at home, then you may want to reach out and contact them. And that's a private pay, but you can find out under the private pay, what does that mean? How much would it cost me? Or is there any waivers or anything like that? So you'd be surprised. You want someone to help you with your groceries. You want someone to help you clean your home. You want to talk to someone for companionship, transport you to and from your appointments. It's all kinds of things that Comfort Keepers can offer in reference to making sure that the seniors and persons with disabilities are comfortable and maintaining in their home. So now, with that being said, we also know that there's more agencies similar to that. So if you're not, sure, or one they call Comfort Keepers, Google it. Find out what agencies provide home care so that you can stay in your home. It might be Home Instead. Right now, you see a lot of different commercials that's telling you about senior care, living at home, staying at home. Use them. Call them up and see how much they cost, what services they provide, what areas do they cover, how many hours do they cover. You may be a caregiver for a elderly parent, and it's a good thing to have your parents and do what you can, but you also can get burned out. So sometimes you may need those additional hands. Call one of the agencies and find out if you can get some additional services, some support. Now, money shouldn't be an issue when you're stressed. Okay. When I say it like that, maybe I just need a few hours away from the home to go to the mall or something, or go for a walk. Well, a service like Comfort Keepers can come in and tell me that, for 4 hours they can stay and be a companion to my parents for a little while, make sure that they have their lunch or something, so that I can go out and have a moment in time for myself. All right. So that's what we're going to look at. We don't look at it like, don't look at the cost. Look, look at the outcome of it. Like, I got support here. I got a relief. Okay. And those who are caring for children, you're the same way. Now, I'm not saying you call comfort keepers, but you're caring for children, and now you're working from home and caring for children. Sometimes you want to break as well. You're like, my kids are at home, I'm working from home, everything's at home. If you find it's overwhelming, you have to put in perspective that you need a break. And what do you need to do? Go for a walk for an hour a day, go in your backyard and do some yoga moves and take deep breaths. Uh, if you can find a mall open or whatever, go to a mall, walk around, see if there's some things so that you can still regain your own health and wellness, so that you don't overwork yourself trying to take care of others. But I know this is personal, but me, I may take a bath at 1 or 2 in the afternoon. We're at home. Okay. So if you have to, take a bath. Take a bath at 2 in the afternoon. And if it makes you nice and cozy, go take a nap. Okay. If you feel like it, ladies and gentlemen, you're home with the kids, get the kids a bath and then put them in bed. Take a nap. We need to go back to that. I know it sounds funny, take a nap, but we used to take naps. What happened? Well, I know everybody's parents one point in time told them, go lay down, take a nap, especially when you're running around a lot. Well, sometimes you have to do that for yourself too. Take a nap in the middle of the day. If your lunch hour is for 1 hour and you're always on the phone, take a nap. Maybe you're not hungry. Take a nap. Okay. Sounds funny, but it's true for now, and it does help.
When I was growing up, my mom was extremely tidy. We were trained to put things back where we got them from. One day, when I walked into my mom's house, I felt like I walked to someone else's house. There was stuff everywhere. And just growing up the way I grew up, and to see this transition was very alarming.
When Sean talked to me, it was a wake-up call, and that's when I went to the doctor.
If you love them enough to do this, surely you'll check NHTSA.gov/the right seat to make sure they're in the right car seat.
You're there for them. We're here for you. Find free care guides at aarp.org/caregiving.
If you love them enough to crawl into a play place to get them to come down, then surely you'll check NHTSA.gov/the right seat to make sure they're in the right car seat.
All right, so moving right along, we went to, so who did we leave off? Okay, so we have to talk about bridging communities. Okay, now with bridging, what I want you to know about bridging communities, they are one of the, no, I shouldn't say one of the oldest, but well sought after agencies in reference to elder care services. So if you have a elderly parent who is seeking housing or something, you might want to contact Bridging. They have a beautiful community where they have apartment settings for seniors, and especially seniors who are caring for grandchildren. It may be a situation where the parents are no longer able to care for their grandchildren, or the parents are not able to care for their children, and the children are now a part of the grandparents' upbringing. So that way, the kids have to be cared for. Bridging has a facility or two that allows the children and grandparents to live together. You want to check into that. They have so many different services that they offer, not just that program, but there's a food pantry program that they work aligned with, so that they can deliver food to the senior services, and you might want to check with that. Also, their repair program, where there's their catchment areas. They have over several zip codes, and you may have a situation where a door is off the hinge, a window was broken, and you just want that window fixed or that door put back on. Call Bridges and find out what resources and services that you can utilize from them. So, it's serving seniors in their communities in the Southwest Detroit area, but they also go beyond that. So you may never know until you call. And when you call Bridging, if they can't assist you directly, they do have a referral service that they will connect you with another sister or brother agency that can help you just as well. So these are the things that make sense for you to try while we're going through this moment in time. Look for things that can help you maintain your loved ones in the home. Look for services that can give you medical resources or discounts. Look for food pantries that can, help plenish the foods for your family. It could be milk, it could be cheese. During the holidays, people are looking to get turkeys and hams and stuff like that. Well, we don't have to overdo it, but if you have food items that you can share, share. If you have more than one turkey, can you give that turkey, another turkey, to another family member? Or can you see about your neighbors, if they're elderly, about if they would, accept a home cooked meal from you, or if they have plans to be with somebody? We need to become closer, ladies and gentlemen, especially during this moment, because at this time you don't never know who's going to give you a hands up. You don't never know who's got to give you blood. So when you think about it, all of us are in the same boat together. And why not try to help or support one another? And that is key to getting out resources. Here at Just Ask, that is our goal. Our primary goal is to make sure that we provide the resources that are needed throughout the state of Michigan and beyond. And just knowing that I interview enough individuals about their agencies lets me know that there is so much out here that we have no idea about. And so we try to bring it to you in short, 30 minutes or whatever. Maybe you don't have the brochure. Maybe you didn't know about that agency even exists. So you can always give us a call or give me a call, 1-800-323-5336. And that number should show up at the bottom of the screen, 1-800-323-5336. And you can give us a call or email. You can email me if you want, Marsha at justastalkshow.org, or just go to the Just As Talk Show website and watch a show that you haven't seen before, or wait till you see them on Fridays at 2:30 in the afternoon. That'll be more fun, okay? So if we haven't talked about or touched on a subject matter that you're interested in, you can always just reach out to us and give us a show idea. But we greatly appreciate you all supporting us, and that is so important to us to know that we're getting the support of people, our friends and family here in Michigan. Can't give a shout out as too many of you, but I want to thank you all for responding on the Facebook page of when we do what we do. And I see all the little love marks, the thumbs up, and all that. And that's great. Okay. That's really great. So thank you. So now, from time to time, like I said, if you have a show idea, you can just go ahead and email me, and we'll get to it. We'll let you know. So if you are a program director or a service providing agency, let us know so we can share the information with our viewers about what it is that you're doing and how to locate you. Okay, that's one of the main things we try to take care of. If you are an individual going through a crisis of sort, you can give us a call, and we would definitely try to refer you to an agency to get you some help or some support for your family or yourself. We can do that as well. And if you have a show idea, you can always just, hey, Marsha, have you done this one? If we haven't, we will. How about that? All right. So I'm almost tickled to say that it is a pleasure to know that you all tune in and are learning about our agency as well. We've been around a long time, uh, kind of low key, but not anymore. So that's why I said I always want to let you know that we're here for you. And if it's not, on Facebook, you can definitely go to your cable stations and look for us, or go to our website, justastalkshow.org, or catch us on channel 56. And definitely share this information with friends and family. And always remember, it may not be for you, it could be for someone else, the lady next door. Okay. Uncle Ed, Um, my mom needed a walker, and I didn't know where to start because we can't afford it. Well, now you know you can contact a business like World Medical Relief. And definitely, I'm going to tell you this too. When I was talking to Josephine Jabara of World Medical Relief, she gave me insight on incontinence care. And incontinence care is the diaper program. Now, you know, some people are like, I don't use that word diaper. You don't have to. It's incontinence care. But you can definitely reach out to them and find out more about the incontinence care program so that you don't have to go to the drugstore and pay $40 for 20 diapers. $40 and for 20? Now you know you can run through the 20 in 1 week and then you out of 40 more dollars. Check out World Medical Relief. See if you can qualify for that program, and I guarantee you will. And then I want you to call me 1-800-323-5336 and tell me, Marsha, that program worked because I want you to get what you need. Don't have to stay home. You can also, if you want, and this is going to be my last little note, you can also check with your insurance agency to see if you qualify for incontinence care. Now, your doctor will write a prescription. You call, you can go online and look up the incontinence care services, and they will send you different companies who have diapers so that they'll send you samples. They'll send you samples of 3 or 4 different kinds, and you try the ones you like. And then when you decide which one you want, you call the 800 number and put the order in. The insurance company pays for that. So it depends on what kind of insurance you have. You want to check that out, make sure that your insurance company, will allow you to have that benefit. If not, you definitely want to check out World Medical Relief. But Medicare, Medicaid, it's on the pop and you can get it. Okay. So other insurances I'm not sure about, but you can definitely try. All right. So I just want you to know that if you in the midst of a situation with your insulin, in the midst of a situation with incontinence care, in the midst of a situation needing a wheelchair or a hospital bed, don't hesitate to reach out to any of the agencies we talked about this afternoon: World Medical Relief, Detroit Recovery Project, Comfort Keepers, Bridging Communities. Look for something, call them and just ask them, what kind of not what kind of services, but I'm in need of a service, and do you provide this? And if they say no, we don't have that, then find out if they can refer you to another agency to get the service. Now, ladies and gentlemen, my phone is buzzing because I guess people are asking questions about Just Ask, and I'm not going to answer it online, but I'm going to answer it after we're done. So I think that a lot of you are paying attention today to what we're talking about, and I appreciate that, and that's a wonderful thing. But I'm going to wrap up. So at this point, I appreciate you, and always remember, once a month you'll have a recap of all the services you've seen. And if you have any questions, give me a call, 1-800-323-5336, Twitter, Just Ask Talk Show, hashtag Just Ask Talk Show, or email me at Marsha at Just Ask Talk Show. Now, I'm your host, Marsha Florence. And what do I always say? If you know a person with a disability, or if you just have a general question, don't be afraid to ask. Just ask. I'm your host. Thank you. See you next time.